The main thing to look out for is remembering that periods are a vital sign. If they're not on hormone or birth control, if they are obviously on the pill and things, that's not a regular, it's not a regular bleed. But if they're not on hormone or birth control and they're not pregnant, then they should be having a regular menstrual cycle.
So someone comes into my clinic and I will always ask at a first appointment, I will be asking about whether they've got normal periods.
Yeah.
And they say, well, they're a bit irregular, and actually I'll think to myself, well, that's interesting. I'm not quite sure what I do with that information. So where do I go from there?
So ask them, do you track your cycle? How much does it vary by? Do you have a graph? So if you've got an app on your phone like Clue or Flow, these are free apps, you can put in the first day of your menstrual cycle, and then every month it will tell you, okay, your cycle varies by this amount. And that's really good because you can show your gynecologist or your osteopath or whoever, this is my typical cycle. Yeah. You can see, oh, okay, Sarah's telling me this, and it varies by 1 day, 2 days, it's 33 days, 35, 32, 33, 34, 35. That's a normal cycle. If it's sort of 28 days, 35 days, 29 days, 45 days, that's usually PCOS. That's not usually, that could be a variety of other issues, but that's a sign that it could be PCOS, especially if they've got other symptoms. So that's a chance to kind of ask more questions, but also really understanding their quality of life. A common complaint of PCOS is fatigue. So that's something so many people are dealing with, especially with burnout, post-pandemic and everything else. And the last couple of years has been really hard on people, but those signs of insulin resistance. So if they're getting constant sugar cravings, do they most importantly exhibit the signs of hyperandrogenism, which as physical therapists you might be in a really good place to notice. So that acne that looks really angry, it looks really angry. It's not just 1 or 2 spots before your period, it's that cystic inflammation. Do they have any signs of excess hair growth, perhaps in places they may not want it as women, on their neck or their chin, their jawline, maybe thicker hair, maybe on their stomach and back and things. And again, this will vary depending on ethnic groups, so you shouldn't automatically jump to a conclusion of PCOS.